Hi everybody and welcome back to the channel. Today we're diving into a topic I know a lot of you have been asking about: how to get back to squatting when you're dealing with knee pain. Knee pain and pain in general is extremely complex, and there's no one size fits all for coming back to pain-free movements. However, most of the time there is a lot you can do on your own to manage your recovery without spending tons of money on expensive treatments. By the end of this guide, you will have a clear plan on how building your way back to squatting pain-free. And if, after trying the method in this video, you still don't see improvement, then you should of course contact a professional. Let's jump in, you guys. But before anything, what is pain? We used to believe that pain was simply the result of physical damage, like the body sending a signal to the brain to alert it from an injury. But pain doesn't work that way. And while this outdated biomechanical view is still very common, we now know that pain is more complex than that. Today we understand that pain doesn't come from the body, but it comes from the brain. And pain is a protective reaction playing a crucial role in our survival. For example, if you touch something very hot, then your brain will send a tremendous pain signal, forcing you to remove your hand quickly to avoid further damage. And this is extremely helpful because it protects us from serious injuries. However, the brain sometimes overreacts. It can create pain when there's no significant injury, just to protect us. And this can happen due to various factors. And just to name a few, it could be stress, lack of sleep, insecurity, fear, you're going through tough times, or simply because of the complexity of the brain. So what does it mean for you? It means that just because you experience pain, it doesn't necessarily mean that you have an injury. It just means that for some reasons, your knee's capacity is lowered to a level that prevents you from squatting without pain. So the question now is, how do we know if the pain means damage or not? And does the pain level match the severity of the injury? Well, we can never be sure. But if pain manifests after a long period of overtraining or after a direct trauma on the knee, like after a heavy lift attempt or a hard landing after a jump, or you've been tackled by someone in a contact sport, well, that's explainable pain due to an injury. It could be more or less serious depending on the intensity of the trauma. But it could also be that you show up to training and suddenly you feel pain without any explainable reason. Sometimes spending a little more time warming up and adding some extra reps in the warming sets is enough to make the pain disappear and never come back again. And even though it sounds strange, it's very common. And it makes a lot of sense when we know that pain doesn't necessarily mean damage. Maybe your brain was a little overprotective that day, and that's it. And sometimes the pain doesn't just go away after warming up. You can try squatting with lighter weight. You can also try to adjust the technique a little to see if it makes a difference in the sensation, or you can simply stop squatting that day and hope that it's gone next time you try. But if you feel pain during the next squat session, then it means that warming up alone is not enough and your knee is probably sensitized or overstimulated. And if you really want an explanation for your pain, don't start by assuming that you might have lifted with the wrong technique or made a wrong movement. I actually made a whole video about technique, and the link is in the description. But what really matters is to think about how much volume and load your knee has been through the last couple of weeks. For example, if you started running suddenly and with high frequency and volume, then maybe it was too much too soon for your knee. Remember that volume is the total stress on your knee during the day, not only when you squat. Or have you been lifting more than usual lately? Was it heavy for a long period? Have you been sick? Did you take a break from lifting because of holidays and came back too hard? Are you going through tough times? Are you sleeping well? These factors could also contribute to your experience of pain. When it comes to traumatic pain, you know exactly why you experience it. You got hurt, and your knee will need some time to heal back to normal. Like, for example, when you burn yourself, you know it hurts when you touch the burned area, but you don't panic about the recovery because you know it will stop hurting eventually. Sometimes it can take a couple of weeks before it's completely gone, sometimes a couple of months, and for the more severe injury, it can take up to 1 year of rehab. And if you're in doubt of the severity of your injury, please seek professional help. So the idea here is to back off a little because your knee is not at 100%. Try to establish a baseline where you can squat a weight without too much pain, even if it's way lighter than you're used to. And sometimes Small adjustments in the technique can make a big difference in the sensation of pain. You could change, for example, the foot position. Try a little wider, try to change the angle of your feet. You can also try to change the depth of your squat. You can also try to take the bar a little lower. You can also try tempo squat, slow on the way down, slow on the way up. These small adjustments in technique can help distribute the load differently and minimize pain. But remember, if you change the technique and it feels better, it doesn't mean that the technique in itself is better. It's just better for you at this moment to continue lifting while your knee heals and come back to normal capacity. Try to keep the volume relatively low. Something like 3x10 or 5x5 would do a great job. See how your knee reacts the day after, and if it didn't make it worse, then you're on the right track. If you made it worse, then maybe you should try with lighter weight next time. But once you have that baseline, you can start gradually increasing the load. A good rule of thumb would be using the 10% method. Don't increase the volume or the load more than 10% per week. Don't be too eager and try to rush things. Remember to be patient and respect the healing time. If you feel pain even with a bodyweight squat, this means that your knee capacity is lower than your body weight, and you should back off from squatting normally for a short period. Your knee is quite sensitized to knee flexion, and you cannot squat without flexing your knee. So you can give your knee a little break from flexion while training around the pain. One good strategy is to limit the range of motion to a tolerable capacity. Box squats are a great option. You can still load your knee, enjoy the feeling of the barbell on your back, and slowly reintroduce more and more range until you don't need a box anymore. Tempo squats are also a great option here because you can be more in control and be more in connection with the irritated area. You can also do specific knee flexions exercise beside your box squat to start reintroducing some knee flexion capacity. Depending on how sensitized your knee is, you can start more or less conservative. A conservative option could be knee flexion with a light band. The knee over toe lunge with front foot elevated is also a great way to reintroduce knee flexion at low intensity. With time, you could lower the elevation or simply start adding load. You can also decrease your body weight by holding on some rings over a post, for example. The Spanish squat hold seems to have good results as well, especially if you're dealing with jumper knees when the pain is in the frontal part of your knee. Try to include 45 seconds hold for 3 sets in your sessions, for example. Another great way to reintroduce knee flexion into your training is the hinge to squat with the kettlebell. You can start, for example, with 100% hinge and slowly introduce more and more knee flexion until reaching a full goblet squats. This is also a good way to assess how much tolerance to knee flexion you have. You can also squat on the way down and hinge on the way up, for example. Once you build more tolerance to knee flexion, you can continue up the ladder with more demanding exercises to build further capacity to knee flexion. For example, the reverse Nordic or the sissy squat. Now let's talk about training with pain. It's important to understand that training through some level of pain is often okay, as long as the pain doesn't exceed a 5 or 6 out of 10 on the pain scale, with 10 being the maximal pain you can tolerate. Because during a rehab, the goal is not to train completely pain-free, because the same level of pain while doing more work means improvement in your capacity and pain tolerance. And it's a good indication that you're building tolerance and resilience. Just make sure to listen to your body and don't push through pain that feels very sharp or sudden or worsening. There is one last thing I would like to cover, and is chronic pain and why staying active is so important. When knee pain becomes chronic, it's often due to a vicious cycle of reduced activity. When you avoid a movement because of pain, your knee's capacity diminishes even further, leading to more pain and less tolerance for activity. And this is a cycle you want to break. And staying active is key. Motion is lotion. You have heard it before. Movement will help you maintain your knee's capacity and even increase it over time. It's all about finding the right level of activity and slowly building up from there. Yes, it might be very frustrating and slow at times, but this process will help you avoid the downward spiral of inactivity and worsening of pain. And remember, rehab doesn't go in a straight line. There are ups and downs, and that's completely normal. What's important is that you keep moving forward even if the progress seems slow. All right, that's it for today, you guys. And I hope this guide will help you, give you the confidence to start working your way back to squatting pain-free. And if you found this video helpful, please hit the like button and subscribe to the channel. See you guys.